Hello and welcome back to the channel. Today we're talking about something you've probably seen in your local pharmacy but might not fully understand. Hydrocortisone, a medical steroid that can be life-saving for some but dangerous for others if misused. So what exactly is hydrocortisone? How does it work in your body? And why do some bodybuilders talk about using it? Let's go through everything. The benefits, the side effects, medical uses, illegal use, and much more. Bazi, what is hydrocortisone? Hydrocortisone is a corticosteroid, meaning it's a medication that mimics the body's natural hormone, cortisol. Cortisol is produced in your adrenal glands and plays an important role in managing stress, inflammation, and blood sugar balance. When your body doesn't produce enough cortisol, or when there's too much inflammation, hydrocortisone is used to replace or regulate this response. So hydrocortisone is not an anabolic steroid, which builds muscle. It's an anti-inflammatory hormone medication. How does hydrocortisone work in the body? When you take hydrocortisone, whether as a cream, pill, or injection, it begins working on several systems in the body. Hydrocortisone suppresses the immune system's overreaction, reduces inflammation by blocking chemical messengers, cytokines, affects metabolism, including fat storage, salt balance, and blood sugar, reduces swelling, redness, and itching in skin conditions. That's why it's used to treat many different conditions, both chronic and acute. When and how is it used medically? Hydrocortisone is used in both topical form, cream or ointment, for skin conditions, and systemic form, pills or injections, for internal or more serious illnesses. Medical conditions where hydrocortisone is commonly used are Addison's disease, when the body doesn't produce enough cortisol, severe allergic reactions that don't respond to other treatments, skin conditions like eczema, dermatitis, sunburn, autoimmune or rheumatic diseases such as rheumatoid arthritis, asthma or COPD, occasionally in emergency care. It's a very versatile medicine, but it must be used carefully and under supervision. What are the side effects? Side effects depend on how long and how much you use. Common side effects with prolonged use are thinning skin, especially with overuse of creams, increased risk of infection due to immune suppression, high blood sugar, weight gain, facial swelling, also known as moon face, sleep issues, anxiety or depression. With injections or high doses, it can cause osteoporosis, high blood pressure, and muscle breakdown. That's why doctors always aim to use the lowest effective dose for the shortest possible time. How is it used in bodybuilding? Hydrocortisone is not typically part of performance-enhancing drug routines in bodybuilding, but some people do misuse it, for example, to reduce inflammation after intense workouts, to treat joint or muscle pain, to mask pain and keep training despite injuries. This is very dangerous. Why? Because long-term use of hydrocortisone can break down muscle tissue and actually make the body weaker, not stronger. Another risk, when your body receives hydrocortisone from the outside, it can stop producing its own cortisol, leading to hormonal imbalances. So misuse is dangerous for both physical and mental health. Who typically uses it legally? Hydrocortisone is used, legally, by many groups for real medical reasons. For example, people with chronic skin diseases like eczema or psoriasis, patients with adrenal insufficiency, Addison's disease, children with severe eczema under strict medical control, athletes, sometimes under medical exemption for severe allergies or asthma, elderly people with autoimmune or inflammatory conditions. Some elite athletes, for example, have been prescribed hydrocortisone for medical reasons, but only with official approval and strict monitoring. Using it as part of a training routine without a medical condition is not accepted and often banned in professional sports. Benefits when used properly: rapid inflammation relief, very effective for eczema, allergies, and joint pain, life-saving in cortisol deficiency, available in various forms: cream, tablet, injection. Risks and downsides when misused: increased risk of infections, hormonal imbalance, muscle loss with long-term use, mental health effects, skin damage, especially with overuse of creams, adrenal suppression, the body stops making its own hormones. Legal warning: banned without prescription. Hydrocortisone is a prescription medication, not a supplement. Using it without a doctor's guidance is illegal and dangerous. While some mild creams are available over the counter in pharmacies, they are low strength and for short-term use only. Anything stronger or taken orally or by injection must be prescribed by a doctor. This video is not meant to promote the use of hydrocortisone. It's here to educate, inform, and prevent dangerous misuse. Conclusion. So, hydrocortisone can be an incredibly valuable medicine when used the right way under medical supervision. But it's not a training shortcut, and it's not safe when used without reason. Misuse can lead to serious long-term consequences, physically, mentally, and hormonally. Have you ever used hydrocortisone? Was it prescribed for a medical condition? Let us know in the comments. Don't forget to like the video, subscribe, and share with someone in the gym community who might need this info. Thanks for watching, and take care.